Ladies and gentlemen, thank you for standing by and welcome to the COVID-19 media briefing conference call. At this time, all participants' lines are in a listen-only mode. After the speaker's presentation, there will be a question and answer session. To ask a question during the session, you will need to press star 1 on your telephone. Please be advised today's conference is being recorded. If you require any further assistance, please press star 0. I would now like to hand the conference over to your speaker today, Mr. Mike Schomer. Thank you. Please go ahead, sir.
Thank you, operator, and thank you for joining us for the COVID-19 media call for December 14th. We'll start today's call with comments from Health Commissioner Jan Malcolm and Infectious Disease Director Kris Ehresmann. We'll then open it up for questions from reporters on the line. With that, we'll turn it over to Commissioner Malcolm.
Thank you, Mike, and good Monday afternoon to everyone. The rapid pace of growth of COVID-19 continues around the world and in the United States. Day to day, the United States is averaging just above and just below 200,000 cases a day, and has been over 2,000 deaths a day. The most recent figures are an increase of 189,000 cases from yesterday and an increase of 1,348 deaths. That is collectively for the United States. So we are at now over 16 million total cases and very, very close to 300,000 deaths. Sadly, I'm pretty sure we're beyond that number as of this hour. Here in Minnesota, we have announced 4,433 new cases on Saturday, 3,431 on Sunday, and the total for today was 3,026. We had also a total of over the weekend of 67 deaths reported on Saturday, 85 reported on Sunday, and thankfully 18 reported today, although we have noted before that Mondays sometimes are a lower day for reporting. As we've discussed, these figures are reports from the mortuaries, not reflecting the actual date of death, but when the reports come in to our system. So we are now at a cumulative total of 381,841 cases in Minnesota and a new total of 4,462 deaths in Minnesota. There have been a total of 19,638 patients hospitalized, 4,255 of whom have received intensive care. There are currently 1,283 people hospitalized in Minnesota hospitals with COVID-19. 319 of those are in intensive care. Now, one of the more encouraging signs recently has been that hospital beds in use due to COVID have been on a downward trend over the last week, and that has been an extremely important and welcome bit of respite for our healthcare workers in hospitals. Well, with nearly 11,000 new cases reported since Friday and a high death toll over the weekend, clearly we are still in a very precarious state. We're certainly not out of the woods by any stretch, but we do want to note that there is some good news in the recent data. Case growth has been coming down since mid-November, so we're obviously still growing in cases at a pretty high rate, but a slower rate than we had been. Hospitalizations, as I mentioned, are down from their high, but still almost 3 times as many people in hospital as our previous hospital peak in May. After peaking at 15.4% of all tests coming in positive during the highest positivity week, our positivity rate since then has been fluctuating at around 12 to 13%. The reasons for caution include the fact that over the same time period that we saw a slower rate of increase in new cases, we also saw testing rates being lower than they were during that very, very high, very active testing period before the Thanksgiving holiday. And because the decrease in testing has occurred over the same period as the decrease in cases, we just need to keep watching the data very closely to make sure that the decrease in cases is not simply an artifact of less testing. We do think, however, that a fairly stable test positivity rate is a good sign, although we have started to see that positivity rate inch back up over the last week. But again, just keeping our eye on the relationship between testing volume and positive cases detected. And again, even though it is so welcome to see the rate of growth declining, we need to remember that we're still at an extremely high rate compared to where we've been before, and even higher than where other states have been at the top of their spikes. We talk a lot about this measure that we use of the rate of new cases per day per 100,000 people, and that measure being calculated as a rolling 7-day average. And that we've talked about the fact that we consider over 5 new cases per day per 100,000 people to be sort of a caution indicator, and a rate of 10 new cases per day per 100,000 people to be a high-risk indicator. And we are now down below 100 cases per 100,000 population, and we had been over 100 for a while, but that's still a very, very high number. For context, we started seeing our growth rates just turn into that exponential part of the curve at around 30 new cases per day per 100,000 people. And we're still twice as high as we were around the end of October. So we're definitely still in a high risk range when it comes to just the sheer volume of new cases being detected day by day and week over week. To use sort of a time relevant analogy, it's kind of like how the weather starts to feel when it gets really cold. And after a few days of being 20 below zero, zero feels pretty good, relatively speaking. And this is a little bit like that. We still have a lot of cases and a lot of virus out there, and it's just important that we all recognize that we still are in a high-risk situation, and to keep doing what we're doing to keep that rate moving in the right direction, and frankly, to accelerate the rate of improvement in these rates. Because we still see a lot of virus, we anticipate reaching 400,000 total cases before Christmas. And kind of just as a reminder of some of those interesting milestones, it took us 30 weeks to reach our first 100,000 cases, 6 weeks to reach our next 100,000 cases, 16 days or just over 2 weeks to reach that third 100,000 marker. But in the next 16 days, we've added, in quotes, only 62,000 cases. So just indicating that instead of that a time period to hit the next 100,000 getting shorter and shorter, in this most recent time period, you can see how the case rate has slowed a bit, but still 62,000 cases in only a little over 2 weeks is a pretty stunning number. And sadly, if we look at the really most sobering data, the increased rate of people dying that we have seen in recent weeks, those figures remain very, very high, with over 1,000 of our fellow Minnesotans having died just since mid-November. By contrast, it took 12 weeks from our first reported death of COVID-19 to reach the first 1,000 people. It took 17 weeks to reach the second 1,000 deaths, and that was during that sort of summer flattening that we saw with mortality rates improving quite a bit. It then took us only 7.5 weeks, 7.5 weeks to reach the third 1,000 deaths. And then, sadly, it took only 20 days, just under 3 weeks, to reach the fourth 1,000 death marker. So that's just an indication of how, again, if you kind of take a step back and look at these trends over time, you can see how very much things have changed in terms of the shortening of the times to reach new milestones for case growths and for deaths, unfortunately. Again, we want to be clear that there are some really good signs in the data that we hope will continue. We're not, though, in any way trying to suggest that we have passed any sort of a point of needing to maintain great vigilance. There's still a lot of volatility in these numbers and a very great deal of virus circulating. So we so appreciate and we believe we can see the effects of Minnesotans really taking this seriously and factoring this into their decisions and really taking those mitigation measures to heart. And we appreciate that, and we just ask for people to continue to be very vigilant and to help us get through this period of time in the best possible shape for our loved ones and our communities, because there is, as we've talked about, better days coming with the advent of vaccine. And with that, I'm going to turn it over to Kris Ehresmann to give you an update on what we know about the vaccine distribution timeline and process. Kris.
Thank you, Commissioner. Well, it was a very exciting weekend, actually, a historic weekend, actually, as we had the FDA approving the first COVID vaccine and the Advisory Committee on Immunization Practices recommending it for the country. We didn't have time to celebrate because we were busy planning, but we're very excited about the fact that we had our first COVID-19 vaccine shipments that arrived in Minnesota today. The first shipments of the vaccine came to 4 sites across the state: the Minneapolis Veterans Affairs Medical Center, Sanford Bemidji Medical Center, Olmsted Medical Center, and Cass Lake Indian Health Services. And Governor Walz visited the Minneapolis Veterans Affairs Medical Center this morning and greeted the very first shipment's arrival in Minnesota. We expect to receive 46,800 units of vaccine across the statewide regional vaccine distribution hub this week. And from there, we'll be using the spoke and hub model that we talked about last week. The vaccine will be distributed to smaller hospitals or clinics, and providers will then administer the vaccine to healthcare workers in Minnesota. It's important to keep in mind a few things at this point. First, the vaccine supply during the earliest phases of the rollout is quite limited. And the first group to be vaccinated in phase 1 will include healthcare workers and long-term care residents. The priority groups for phase 1B and 1C have been yet to be determined, but we anticipate that they may include essential workers and older adults. It will be several months before the average Minnesotan will be able to be vaccinated, but we will get there. And these first vaccine deliveries are a small but important step in the right direction. In the meantime, we need to be patient and continue to take those measures that keep all Minnesotans safe: wearing a mask when in public, maintaining social distancing, getting tested, and properly isolating and quarantine when needed. I think it's important to keep in mind that even as people are vaccinated, we will still need to maintain some of these mitigation measures, such as masking and social distancing. We know that the vaccine is very effective in preventing disease. We have less information on the role that it plays in reducing infectiousness or transmission. So I think it's important to keep in mind that even as we're celebrating the arrival of the vaccine and what it means for us, there will be a time when we will continue to need to mask up, to socially distance, and to keep on with these mitigation measures. This week, Department of Health staff will be training providers on protocols and procedures for administering the vaccine, with most vaccinations expected to begin next week. While we have hundreds of experienced nurses and vaccine providers in the state, this vaccine is new and complex, and vaccinating thousands of people in a short time is a massive undertaking. So the training is critical to ensure vaccines are administered according to protocols. Our goal is to provide a safe vaccine to Minnesotans, not only safe in the product itself, but safe in the storage and handling and the administration. And so our focus is on safety this week and not speed. And with that, I'll turn it over to Mike Schomer.
Thanks, Kris. Operator, we're ready to take questions.
Absolutely. As a reminder, to ask a question, you will need to press star 1 on your telephone. To withdraw your question, press the pound key. Please stand by while we compile the Q&A roster. Your first question comes from the line of Jeremy Olson of the Star Tribune. Your line is open.
Hi, I was wondering if you could, building on what you were just talking about, Kris, with some states doing some vaccinations today, I've already received some emails from readers wondering why we are, quote unquote, sitting on the vaccine supplies we have. Did we not prepare in advance like these other states that are doing vaccination now? Or can you explain a little bit more why we're taking this extra time compared to some of these other states?
Sure, I'd be happy to. So ACIP met on Saturday, and when the Advisory Committee on Immunization Practices met, they were going over some of the details of who should receive vaccine and who should not receive vaccine, in addition to what was provided by the FDA. And so they voted on Saturday. Then before that vote has effect, it has to be accepted by CDC, which occurred on Sunday, and they publish materials when that is accepted. And so that happened yesterday. And so our teams have prepared all the training guidance in advance, but needed the additional details from that vote to be able to include that. That includes things like for whom vaccine is contraindicated, what needs to happen in terms of co-administration with other vaccines, what evaluation needs to happen for all the people who need to be vaccinated. So there's a lot of details that need to be included. And so our commitment is to make sure that everyone feels comfortable, down to the vaccinators, that they're comfortable administering this vaccine safely. Now, we know that there are some states that are doing some ceremonial vaccination, but the bulk of their vaccination likely will not be happening until the end of the week as well. But that's our commitment, is we want to make sure that we're doing this safely. There are people for whom the vaccine should not be given, and it's important that is being evaluated at the time of vaccination. So there are a lot of considerations, and providers have to attest that they have received training before they can start vaccinating. And so our feeling is we want to do this right, and we do want to do it safely. And that's more important than being the first at this point.
Have you received any information? I mean, I've seen some statistics publicly about vaccine hesitancy or refusal. Have you had a chance to assess uptake or expected uptake in your priority healthcare population?
We know, as you've said, that there has been some level of vaccine hesitancy expressed. A lot of those studies were done earlier, so in the early fall, before vaccine was ready, and also before there was as much education about the fact that the safety processes for this vaccine are the same as what we'd expect for any other vaccine. The FDA just worked really hard to speed up some of their review processes. The FDA commissioner said on Friday that what would normally take them months, they added many, many more staff so that they could expedite the process. So I think as people have heard that safety has not been compromised, but just, we've kind of sped things up in terms of efficiencies, I think that has helped a bit. But we do know that there are healthcare workers who do have some concerns about vaccination. So that's another part of our training, is to make sure that they fully understand both how to administer, but then also messages to give individuals so they can help continue to answer questions.
Thank you.
Your next question comes from the line of Kris Megan of Pioneer Press. Your line is open.
Hi, thanks. With the governor's announcements expected later this week on what he plans to do with the current pause, I was wondering if you could sort of break down what you may have learned from the last month and the pause that's been in place. Have we learned anything new about what situations are more infectious than others, or how the pause in a number of different activities have helped slow the spread?
This is Commissioner Malcolm. I'm going to ask Kris to chime in here, but I'll just start with an overall comment that, as we've said, one of the things we've learned as time has gone along is that it's really good to give a full 4 weeks, if we can, from the time of an environmental event of some sort to really fully assessing the impact. So we've certainly noted that the downturn in the case growth has coincided pretty nicely with the pause, and we think that Minnesotans again are taking this very seriously and are making good decisions about how to best protect themselves and their loved ones. So definitely we think that the pause has been beneficial for just helping again kind of communicate to Minnesotans the importance of these measures and the real serious situation that the state is in and that our hospitals have been in. In terms, the other thing, of course, it complicates it a little is the Thanksgiving holiday coming in there, and again, certainly we know that the executive order and our guidance and our advice to people to really not to do the traditional Thanksgiving and to not gather with folks outside your own household. We know how hard that was, and we know that not everyone did that. So just sort of waiting to see, and that's sort of a national big question too, is what effect can we see from the Thanksgiving holiday? So that certainly is a picture that is still emerging. But you asked some detailed questions there about anything else we might have learned over the last 3 weeks. So Kris, I'll see if you'd like to add.
Sure. I'll say that just, for your interest, Kris, we continued. So for many of the venues that were closed or shut down during this pause, we continued to see cases reported. And you're probably thinking, well, how's that possible if they were closed? It just speaks to the fact that there is a delay in the reporting or getting that information. We have, however, with the pause, seen a reduction. Obviously, we kind of caught up with the cases that would have been occurring or exposed prior to the pause. We've identified them and we're starting to catch up. So that's very positive. And as the commissioner said, we've seen some positive changes in our 7-day rolling average for hospitalizations and ICU admissions, and even our case numbers have declined a bit. But the concern is that they're still at incredibly high levels, even with the benefit of the pause. And so I think that's what is concerning, and that's why we want to be thoughtful about things. We used the analogy last week about the vaccine, and the vaccine being like a fire hose that could be trained on a fire. But obviously, one fire hose on a forest fire won't have as much impact. If we can get our disease spread down, it will allow the vaccine to have a greater impact on slowing spread in the state. So I think those are all the things that are kind of coming together as we're looking at, what happens next and what have we gained. We really want to make sure that we are able to maximize the value of the vaccine that's coming into our state. We've got some really positive things to look forward to. There's good things on the horizon, and we just have to stay focused on the goal and be patient until we can get there. And that still means that we're going to have to continue to do some of that mitigation effort for a bit longer.
Just to follow up, thank you for that. Just to follow up, do you feel like you have enough new information in order to advise the governor on any modifications, whether they be small, things as in maybe reopening certain types of youth sports or gyms or something like that? I mean, do you feel like your information that you've gathered over the last 3 to 4 weeks is nuanced enough in order to make changes, or is it just like it seems to me that you're saying that there really isn't enough new information yet to understand whether or not this has all been worthwhile or it has worked?
Well, I think we would say this, Commissioner Malcolm again. I think we definitely want to credit and thank Minnesotans for what they've been doing that has affected the case numbers, because clearly that's because of behavior change. I think you're asking about perhaps specific sectors and whether we've gathered additional data in this most recent few weeks that would tell us anything we didn't know prior, and I'll just turn it back to Kris to see if you have anything to add. From my perspective, it's sort of the basic story as we've known it, but would turn to Kris to amplify.
Yep. I mean, what we've learned, and when we look at the data, we continue to see that settings in which people are gathering together in groups where masking does not happen or is not possible continue to be where we see transmission. And so all of that information will inform the governor's decisions going forward. But there hasn't been a dramatic change from that basic concept that, yes, when we have settings in which people are gathering together in larger groups, and in particular in situations where they are not masking or where they're unable to mask, then that does lead to more transmission.
Thank you both. Appreciate it.
Operator, I think we're ready for the next question. Operator, if we could take the next question, please.
Well, Mike, we're still here, but I'm not sure if anything has happened to the call line. So not sure if you want to give it a couple more minutes or we just make some conclusion comments.
Yeah, if you want to just maybe make some concluding comments, and I'll text the operator, see if we can get a read on what's happening.
Okay. Well, not sure if we're still transmitting, but if so, again, just want to reinforce how much we appreciate the fact that Minnesotans are clearly looking closely at the governor's recommendations and at the information that we present on these calls, and clearly have been making it, just really reinforcing their efforts to do what we all can do to help slow down the spread. We see that the positive impact of that in the numbers, and just want to try to help remind people that while we've seen definite improvement, we're still in a pretty precarious state, so to speak. So the time for continued vigilance is still the watchword of the day. But with the vaccines actually, the first vaccine now actually approved with the detail that we need to understand how to administer it safely, it is indeed a really important next step in this journey. Anything to share, Mike?
I have not heard anything from the operator, but I do have one question that was texted to us by Catherine Richard from Minnesota Public Radio. Are we still on track to get 183,000 doses before the end of the year?
Yes, Catherine, that is correct. That includes the Pfizer doses that we're expecting to get in this first round, and then the allotment that we've been provided related to Moderna. And that is, of course, based on the assumption that when the FDA, when VRBPAC meets next week, they will vote to approve that vaccine, and then FDA will issue an emergency use authorization. So if all those things happen, then yes, we would expect to get the 183,000 doses. We are waiting to hear. We should be getting additional doses of the Pfizer vaccine, and I mentioned this last week. We were told we would have heard by Friday. We have not heard. We did not hear by Friday, and we have not heard as of today, but we do anticipate that we should get some additional doses of Pfizer. So when that happens, we'll certainly make people aware, but we have not yet heard about that.
All right, and then one follow-up question from Catherine. Clarification on the December 21st start date. She has heard that the VA may be starting earlier or possibly tomorrow.
Yeah, so just to clarify, the Veterans Administration, the Indian Health Service, the Department of Defense, the Board of Prisons, and the State Department are 5 channels of the federal government who will be receiving vaccines, so federal vaccines separately from the Minnesota state allocation. And so they are in a completely different world, if you will, for vaccination. And so when we talk about vaccination starting, we're talking about the providers in Minnesota that are not part of those 5 federal systems. And so our training is for them, and the plan for vaccination is for them. These other entities are separate from us. They order their vaccine separately. It's not included in our allocation. And so it's a little bit separate, even though we're kind of all together in this. So that's the distinction there. And our hope is that we'll get this training done, and that next Monday would be the latest date that we would have vaccination starting.
All right, and then we have time for one additional question, and that will be from Jeremy Olson again with the Star Tribune. Could you talk a little bit more about the people who are contraindicated for the vaccine?
Sure. So any time that you have a vaccine, there are the decisions for who should be vaccinated are based on what you learn from the clinical trials and things. So some of the things that are to be included are if you have a history of an allergic reaction to any of the vaccine components. And so, those would be that's a very specific thing, but we'd have to screen people to see if they have a history of a reaction to a vaccine component. We know that the vaccine was not tested on pregnant women. And so for pregnant women, that's a situation in which they would want to check with their healthcare provider to talk through risks and benefits, the risks of COVID, the benefits of the vaccine, all of those things. So that's another situation that needs to be evaluated. One of the things that is not recommended, so just a temporary contraindication would be having received another vaccine within 14 days. So for instance, if you just got your flu shot this week, you would need to wait before you got your COVID-19 vaccine. So there are a number of details like that are really important that we're considering. And so those are the kinds of things that we'll be going over, in our trainings. The provider guide is a 20-page document that is available for providers, and we do have some on-demand trainings, and then we'll be doing some live trainings a little bit later this week. And then Pfizer is doing twice daily trainings on storage and handling. Because just to remind people, this is the minus 70 degrees Celsius vaccine.
All right, thank you, Kris. Our apologies for the technical difficulties on the call today. We've done well over 100 of these calls, and most of them have gone fairly smoothly, but this one clearly was an outlier. So I do know that reporters have additional questions. Please feel free to reach out to us this afternoon. We'll do our best to turn that around for you. Thank you, everyone, and we'll plan to be back with you again tomorrow.